Hope FM, where you listen and live.
And you're on Praise Junction at Top FM, listen and live. Good afternoon to you. It's actually 14 minutes past 12. My name is Grace Mutiso and you're on Praise Junction. You're talking about mental health self-care, and I'm hosting Dr. Rose. She's a clinical psychologist. Yes. Wait, I've started to forget things so early, Dr. Rose. We were making that joke off air, so I'm forgetting so early. Oh, help me, Lord. Thank you for your company. You can keep your questions coming. This day I will be tackling them. 20933 is the SMS line. At Top FM Live on Facebook, Twitter, Instagram, and YouTube. And on 0717-400-555. That's our WhatsApp line. Allow me to bring back on board Dr. Rose. But before that, I need to talk to men. Yes, men who are listening to me and following us on Facebook and YouTube. There is something special for you this Friday at Sitam Buruburu. Now, Reverend Jesse Mwai and the entire leadership of Sitam Buruburu are inviting every single man to the men's altar, where men are altered as men of action gather in God's presence. Now, this meeting will be happening this Friday from 5:30 p.m. at Sitam Buruburu Main Sanctuary. And if you're not able to make it to Sitam Buruburu, imagine you don't need to worry. You just need to go online, search for Sitam Buruburu. You'll be able to, the service will be streamed live right there, I believe, and you can be able to catch up. The speaker will be presiding Bishop of Sitam, Bishop Callisto Odede. And of course, men, you're invited to come, join together with other men as we set the pace for the year 2023 in God's presence. Let's invite back Dr. Rose. Daktari, karibu sana.
Thank you so much, Grace.
So we promised in this hour that we'll be tackling, the benefits of self-care,
Yes.
And the questions are just too many. So let's tackle that. Then we'll be able to sample a few questions from our listeners. Karibu.
Thank you, Grace. Now, before I talk about self-care, please allow me mention something.
Yes.
That is of great importance, especially in the Church of God, in the Church of Christ. That I want to submit to everyone listening to us that mental disorders are not a respecter of persons. Please let me repeat that.
Yes.
Mental disorders are not a respecter of persons.
Hayeshimu mafuta hata ya bishop,
You only need to be
apostle,
a human being.
archbishop.
No.
Okay.
And I would wish everyone, especially in church, would hear that. It's not a respecter of our religious affiliations. It's not a respecter of our socioeconomic status. It's not a respecter of our academic credentials. It's not a respecter of our marital status. Children are also getting mental disorders. Children are also getting depressed. Small children, Grace, they are getting depressed because of what's happening at times in these schools. And one of the things that pushes young children to depression, and I say this with feeling with a lot of pain, it matters to do with bullying.
Oh.
So, listeners, mental disorders are not a respecter of person. You could be born again, not born again. You only need to be a human being. Just the same way cancer is not a respecter of persons. And I want to request all of us to put our heads together and we support men and women and children who have mental disorder. Something else I've just remembered.
Yes.
Especially in the church. People don't have mental disorder because it's a punishment from God. They have not sinned. No. It's just a sickness like any other sickness.
Yeah.
Yes.
Okay.
I felt I needed to bring that out.
That's important.
That we can become the psychosocial support because of the stigma associated with mental disorders in the society. A lot of stigma. A lot, Grace. Someone who has been diagnosed with a mental disorder, they will take their medication in secrecy. Because they don't want you to ask, this medication you're taking is for what? They don't want to say it. But can we become a safe society?
Yes.
To embrace everybody who has a mental disorder? Not forgetting, any one of us can get a mental disorder.
Now that you talked about that, sorry for digressing, because I know we need to get to the benefits before we get to the questions, especially in church. You've said we are a bit silent about it. We over spiritualize about it. So what happens if a man or a woman of God is diagnosed to be having a mental disorder, and they feel, I'll be seen as if I don't have faith in God? So I don't want to go and see Dr. Rose. I don't. Let me just stay. So for a man or a woman of God, what's the first step for them to do? Because they preach faith 24/7. Yeah.
Number one, acknowledge you're a human being. And it's by the mercies of God that we are where we are. Number one, accept that. Number two, remind yourself, this is not a sign of weakness. It's not a punishment from God. Just the same way someone can get cancer, I found myself in this place. Number three, there are some mental disorders that run in families. They are genetic, like depression, alcohol use disorder. Have you ever seen families whereby it's like every other person drinks?
Yeah.
The grandfather, the uncles. Schizophrenia is also a genetic disorder. Remind yourself you have not done anything. And having a mental disorder has no relationship with faith in God. Completely. It's about a sickness like any other.
Yeah.
Just the same way people are praying to get healed from cancer, from diabetes, from high blood pressure, the same thing you're also doing. Then number four, it is very important for us to create awareness.
Yes.
And I'm glad that now most churches have embraced matters mental health. And I want to salute my pastor, Reverend Oyando, who I remember there was a Sunday. Instead of a sermon, we talked about mental health.
Sita
Mkitengela. So I want to salute my pastor for that.
Yeah.
Because he is an advocate on matters mental health. So let the church embrace. And I'm happy I'm in Hope FM. I really admire this, and I want to say thank you, Grace. Let us spread the information on mental health. God can heal us miraculously because he's Jehovah Rapha, our healer.
Yes.
But he can also heal us through medication. And it's not everyone with a mental disorder that takes medication. Let me also debunk that myth.
Yes.
It's not everybody with a mental disorder. It's only people with severe cases of mental disorders, and it has significantly affected them. Those are the ones who actually have to take medication from a psychiatrist specifically so that they can be assisted to be stable. So let me go to self-care.
Yes.
Now, we said that self-care is intentional. Just the same way you set goals for the year 2023. You set goals for your self-care. And I said self-care is taking time to do things, meaning there are many things. Which are these things? That will help you live well and will also improve your mental and physical health. Now, self-care has 6 dimensions. So let me go into that. 6 dimensions. There is the physical dimension. There is the psychological dimension. There is the emotional dimension. There is personal dimension, professional dimension, and guess what, Grace?
Yes.
There is a spiritual dimension of mental health,
Yes.
self-care.
Wow.
Spirituality has a role to play
Yes.
on matters mental health. That's the truth. And why do we need, what are the benefits? One of the benefits of mental health self-care is that it helps you and I manage stress. Number 2, it lowers the risk of developing a mental disorder. Number 3, self-care. It helps improve my energy levels. So what do I mean when I talk about physical self-care? This is beautiful. Exercise. Did you know exercise lowers stress hormones?
Wow.
And that's why if you're so stressed, my friend, do exercise.
Hit
You are
the
good.
road.
Hit the road. It's not a must to go to the gym. Hit the road. Because when my body senses that I'm stressed, the brain triggers the production of stress hormones. And one of them is called cortisol. How do I lower the levels of stress hormones in my body? Exercise.
Yes.
Hit the road. If you can't hit the road, watch the TV. You have so much of aerobics in the telly. Create that room. If you don't have a TV and you live in an apartment, go up the stairs, down, up, down, up, down. That is exercise.
Yes.
It's not about you do gym. But remember, one has to be intentional.
And make the choice.
And make the choice. Then the other physical, when it comes to the physical dimension, eat healthy. And something else all Kenyans we need to hear, regular sleep. If you don't sleep, your body will seek that sleep in one way or the other.
Yes.
It actually, your body will demand for that sleep. Then the other component of self-care that I want to mention is the component of psychological. Take time to reflect, self-reflection. Have me time. Have me time. Then counseling. At times people think people go for therapy or counseling because they have run mad.
Yeah.
No. There are moments, Grace, in this life. You just want to talk.
Yes,
Talk.
yes.
You don't want answers. You just want to find a safe place. It could even be a friend. You just talk, and then I'm like, finally, it is out of me. And that's why friendship comes in.
Yes.
Friends. There are those of us who are gifted. They are very good in writing. Journal a lot, if that is your strength. Join a supportive group. You see these chairmans we have?
Yes.
You see the WM small groups? They are very important.
Yes.
The Bible study.
Yes.
Those groups are important because you have someone to share with, because they bring us together. Emotionally, how can you take care of yourself? Because I said we have 6 dimensions. Emotionally, one of the things, what is your hobby? What is this one thing when you do? You just love you. There are some ladies, if they cook and they see people enjoying the meal, oh, they feel so accomplished. What is your hobby? Identify it. Some people it's crocheting. Others it's singing. Others it's drawing. Come up in your schedule a time when you'll be doing that for yourself. Love you. If you don't love you, it will be very hard for other people to love you.
True.
Have moments where you treat yourself. And treating does not mean you go to the big hotels. No. You can go to a very simple hotel, sit down, just take a cup of tea, 10 bob, and appreciate yourself. I think it's a high time, especially for mothers. We really need to take care of everybody.
That's a tough one.
I'm telling you, you must reach a point. Because, Grace, you know what?
Yes.
If Rose is not fine, Mrs. Karau will not be fine.
True.
Mama Joy will not be fine.
True.
So, take care of Rose. You see?
Yes.
That's the beauty.
But why I don't know. You know, I was in a fellowship of other ladies sometimes, some girlfriends I have, and they say, you know, the guilt. You really want to go? Your spouse has even told you, go. I've paid for you. And you want to sleep? Go sleep. If that is what will help you calm down. But you go and you feel, what? On the phone. Mko sawa? Amekula. Why do women feel so guilty when you need to have your you time? And you've kept mentioning love you.
Love you. Because let me tell you something I've realized, Grace. If you don't take care of yourself, let's imagine one day I will not be there. Does it mean my children not eat?
No, they will. They will.
You get it?
Yes.
So I need to remind myself, I don't need to be the general supervisor for things to run.
True.
Give people a chance. I know it's hard. That's a fact. It's hard.
Yes.
What happens when you are sick and you're in hospital and you can't speak? Will things run?
They will.
That is it. And I think that's a very hard thing I'm asking ladies to do. But imagine it's important. It's very important. If something happens to me where I work, let's imagine by God forbid, I die. Do you know a few months down the line, someone else will be hired?
Not down the line. Just you are dead and they are thinking, who replaces Nani?
Yes. You get it?
Yes, because
So
work
I
has to
need
go
yes,
on.
So I need to take care of me.
Yeah.
And you don't need to do something much. You can even just lock yourself in the house and you tell the children, Mommy is having her me time for 30 minutes. And that is it.
True.
So that is emotional. Then personal, please set goals. Have time for friends. Just to hang out. Just have time, just do something for yourself. Then professionally, and this one applies to a majority of us. Let lunch break be lunch break. If you can. If it is 1 to 2, let it be lunch break. Another hard one. Remember, this is self-care.
Yes. Things I must do.
I know of a friend who call her between 1 to 2. She'll not pick the phone. It's her lunch break. And she's enjoying her meal. Then something else. Don't carry work home.
Yes.
Do you know there are people you cannot call them past the official hours? But at times some jobs demand you pick the phone. But if it's possible, you know what happens with self-care? What will work for you? What will work for you? Then the one I love most is the spiritual.
Yes.
Spiritual aspect of our self-care. Oh, Grace, let's practice forgiveness. Oh, my.
That is big.
Let's practice forgiveness. Forgiveness as God has said in his word. And this part of counseling, forgiveness is part of counseling.
Yes.
Yeah, it's part of counseling. And if you can't forgive someone because of the pain they caused you. You know, I was reading about Paul, reminding, I think, writing this, I can't remember which part. And he was reminding somebody that, remember how Alexandra, the coppersmith, did me great harm. Even Paul could remember the harm done to him. If you can't forgive because of the pain, go to God. Tell him, Father, I want to obey you, but it's very hard. Help me.
Yeah.
Help me, God. It's true I want to forgive. Help me because I can't. I'm saying that because I have been in that space. And I'm telling you, when God helps you, it is beautiful. Oh, forgiveness is everything.
Yeah.
At times what is putting us down is unforgiveness, spiritually.
Yeah.
Then also let's connect with a spiritual community. There are some churches where they have women groups, Bible study, anything that actually can be of help. So join in a community in terms of believing. Did you know that there are some people, if they dance, if they pray, it makes them feel refreshed. You get it?
Yes.
Volunteer for a worthy cause. Go to a children's home. At times we think we have issues until we go and visit other people and you're like, Father, sorry, I've been complaining too much.
Yeah.
Purpose in your heart. So those are the 6 dimensions of self-care. What works for you? Come up with at least one activity in the 6 dimensions. And purpose in your life as you start 2023. Put it in your heart that this is how I'm going to take care of myself. Because the same things I've mentioned right now, Grace, they are the same skills that will help us manage stress.
Yeah.
They are the same skills that helps us manage stress. So those are the 6 dimensions.
I think that's a good point for us just to pause and ponder and ask yourself, what are you doing physically to take care of your mental health, psychologically, emotionally? You also mentioned about professionally and spiritually. What are you doing in those areas to ensure that you're well mentally? Allow us to have this quick break. When we come back, we'll be sampling some of your questions that have come through our SMS line 20933, our WhatsApp line 0717 400 555, and at Top FM Live on Facebook, Twitter, and Instagram. Don't go away. We'll be right back after some few seconds. We have to pay some bills.
Hope FM, another quality service from Christ, is the answer ministry.
Leadership is more than just what you need to do. I think it involves attitude of becoming.
But it's not like I've figured it out yet.
That's why you need to tune in to Activate every weekday. Join me and Gigi. Learn more about the Catalyst Associates, where you get to explore true leadership and establish your leadership roots. The Catalyst, catalyzing leadership, inspiring leaders.
This January, the CETAM Women's Ministry invites you for an uplifting time of worship and
So could they be having a mental issue?
Okay, thank you, Grace. Let me mention that when it comes to diagnosis of a mental disorder, we don't use just one symptom. We must have a multiple. There's a criteria that we use for diagnosis. Just the same way when you go to the hospital, it's not the headache that will send you to the laboratory. The doctor has to pick a few symptoms that reflect could be having malaria. So what I would say, if someone is doubting themselves and wondering whether they have a mental disorder or not, then it will be important for them to seek help from a psychologist. So that now a psychologist will be in a better place because there's something called clinical intake, whereby I listen to you, I listen to your history, I listen to what you have gone through life, and that in itself will help me understand you and get to know whether you have a mental disorder. And all mental disorders, they are assessed using standardized tools. So it's not just a tool I will pick from nowhere, no. We have standardized tools, and these tools are informed. For me to do an assessment on depression, that assessment is informed by the symptoms I have picked from you. So my answer would be, if you are wondering whether you have a mental disorder, just seek some help from a psychologist and they'll be in a better position. But don't use one symptom to diagnose yourself with a mental disorder.
Okay.
Yes.
Kialo says, tuned in from Kitui, asking, kindly ask Daktari to shed some lights on difference between postpartum depression and psychosis.
Okay, thank you. Now, baby blues, there's something called baby blues. When ladies give birth, You are tired, you have some mood swings, your sleep pattern is disturbed, even you are sad. Basically, we call that baby blues. But this baby blues is anything, those symptoms for the past few days up to 2 weeks. Right?
Yes.
So up to 2 weeks, we'll call them baby blues, and they will just disappear on their own. However, if these symptoms persist for more than 6 months, now you're not talking about baby blues. You're talking about postpartum depression. It's very important that when you're diagnosing a mental disorder, the time factor is a criteria that we use. First 2 weeks is okay, that's baby blues. But if the symptom persists past 6 months to 1 year, and then these symptoms, they become more intense, whereby now with the postpartum depression, you find someone having it a challenge to bond with a child. Actually, you're looking at a child like a stranger. Who is this? Who is this?
And that's your child.
And that's your child. At times, you are lost with thoughts of killing this child. Right? And then apart from that, you feel like harming yourself, also harming the child. And then there is this grace, the fear of being a good mother. Will I be a good mother to this child?
Yeah.
Right?
Yeah.
So it is the similar symptoms like baby blues, but now the intensity is higher. And now there's the addition of not bonding with the child. You have feelings of harming yourself or even having the child. Can you imagine looking at your child and you wonder, who is this? Right? Then you withdraw from people. You start withdrawing from people. Now, this is where family comes in. The family comes in because this person is not pretending. This person is sick. Now they're having what we call postpartum depression. And there are many ladies who have gone through postpartum, but the family members don't understand.
That's what I wanted to ask. So how can a family member know, by the way, imagine Hajifanyi, she needs help.
Yes. I'm glad you're talking about it now. Creating awareness on matters, mental health. If someone is married, this is where the husband comes in. If someone is not married, this is where friends come in. Because you know what? If not handled well, do you know that person can kill that kid? Because they are sick. It's not that they are bad mothers. Now, what happens? Postpartum depression can now graduate to becoming postpartum psychosis. Anytime you mention some psychosis in psychology, psychosis is characterized by 2 things: hallucinations and delusions. So this mother who has given birth, she starts hearing things. She starts feeling things. She starts seeing things that are not there. You find her speaking with invisible people. Now, it is worse when they hear voices that tell them to kill the child. Now, that's what we call psychosis. And delusions is whereby someone has strongly held beliefs that have no proof. Like I come here and I say, I am Uhuru Kenyatta. People look at me and are wondering, are you okay?
Okay.
And you know what? With delusions, you cannot change that person's thoughts. They are fixed. Something else, what happens with postpartum psychosis, apart from that, one has obsessive thoughts about the baby. You're obsessed about the baby. Even don't anyone to take the baby. You want to hold on to the baby. The whole day, the whole night. And at times you want to put the baby down. So people can tell, there's something not normal here. You remember behavior and observation?
Yes, yes.
Then there is the issue of paranoia. You fear, the fear of unknown. Someone just fear things that are not in existence. And then someone can end up having a lot of energy. Hyperactivity. Someone has a lot of energy. They want to do this, they want to do that. If you measure that against what is normal, they're overdoing it. So that is the difference between postpartum depression and postpartum. Now, with postpartum psychosis, there someone will require a psychiatric review.
Yes.
And even with postpartum depression, someone will require psychiatric review. Why do I say psychiatric? Because that person will need medication. Psychologists, they will counsel. But if your case is severe, you will need a psychiatric review so that the psychiatrist can actually recommend some medication. But this medication is not forever. It's to help stabilize you.
Okay.
Yes.
Yeah. Okay. Let's continue. I think I'm just listening all that. My head just went, oh God, please help anyone going through that. Now, this one seems to know you well. A listener says, thank you for bringing Mam Rose from Sitam Kitengela. And they are asking, kindly help how to handle death, especially the loss of a mother, where someone reaches a point of being irritated, seeing people with their mothers and becoming angry when you hear other people talk about their parents.
Wow.
Is that a mental issue?
Now, that's loss and grief. Loss and grief. And when it comes to loss can be loss of anything. Not just a human being. It can be loss of a job. It can be loss of a house. It could be loss of a relationship. And loss and grief is a very challenging process. Because mourning is a process. You will never arrive in the mourning process. So what I would say, this person is still mourning. Given the context, she is normal in the sense that she is still mourning the loss of her mother. When it comes to mourning or loss and grief, we have 5 stages of mourning. We have the stage of denial. You are refusing. You have the stage of anger. You have the stage of bargaining with God. Then you have a stage of depression. And then the last stage is acceptance. Now, acceptance does not mean you accept it was okay, that person died. No. Acceptance means you reach a point and you realize, yeah, we did the best we could do. God is sovereign, and he did it. And I cannot keep on struggling with it. But at the same time, loss and grief, the 5 stages are not linear.
Yeah.
You can move from one stage to the third. Then all of a sudden you go back to the first.
Yeah.
Something else. Loss and grief has no time duration. It doesn't. So I would recommend the person who's written, kindly seek help from a counselor.
Yes.
So that they can help you process the loss. That's what we do. You process the loss so that you get to a point whereby you accept it. And once you reach the point of acceptance, you still struggle to see people with their mothers or to hear people talk about their mothers, but with the time, also God helping you, you'll be able to overcome it. So she's still mourning. She's mourning.
Okay.
Yeah.
Let's tackle a bit about workplace. And there is this listener who says, I want to read 2 questions for you, Daktari. I would want to know more about this topic because currently I'm feeling tired and I feel like leaving work because I feel I'm not progressing. Another one writes and says, my workplace is very toxic. Analyzing my 2022, my patience was put to test. The workplace I had dreamt of became very toxic with so much witch hunting from the directors to fellow staff to a point of my director becoming the spreader of rumors. Warning letters were issued on basis of their emotions since the consortium I work within recognized my efforts big way. For self-care, should I resign? Kindly advise.
Wow.
The first one was a gentleman, and this sounds like a lady.
Now that's a toxic environment. And let me say something about burnout. They could be experiencing burnout. And burnout is an occupational phenomena. It happens at our workplaces. And what are the 3 dimensions of burnout? Emotional exhaustion. I can tell those 2 listeners they're emotionally exhausted. Number 2, there is what we call depersonalization, whereby you lose empathy. You're just there. I mean,
Uko tu.
Nothing surprises you. When people are surprised by something for you, it's like, okay, you know, you lack empathy.
Yeah.
And the third component of burnout is what we call diminished feelings of accomplishment. You look at yourself and you are wondering, what have I achieved? And how do I know that I have burnout? Because I have been in that space. I don't know how many times, our dear listeners, you felt sick, completely sick. I mean, you are sick. You go to the hospital. They do all the tests, and the doctor gives you a clean bill of health and tells you it is fatigue. When you hear that, it just means you're experiencing burnout.
Yeah.
So the question is, I would not recommend resign, but I would recommend take care of yourself. Now that you know your environment, what is this that you can do on your own? What is this spiritually, physically, emotionally? What can you do to take care of yourself prior to going to that environment? Because the environment might not change, but how will you survive in that very environment? And to crown it all, prayer. You need prayer so that, as the Bible says, do not be anxious about anything, but through prayers and supplications, make your request known to God. And the peace of God. Yeah. That's very important. So as you do self-care, remember there's something we call the peace of God.
Yes.
And once God gives you that peace, God will fight the battles for you. Because at times our workplaces can be toxic. Let God fight for you. But also as he fights for you, self-care is important.
Okay.
Yes.
How can you deal with financial depression?
Financial depression.
Yes.
Okay. Let me say depression is a mental disorder, but there are many triggers of depression. To some people, it could be finances. Others, it could be children. Others could be marital issues. Others could be occupational issues, right? At times, it might require someone, because I don't know whether that person doesn't have a job, or I have no idea. But at times, it's good always to engage with people who can help you with financial management, or people who can help you get a job. It's always good to know who can help me in a given environment. If you're having financial issues because you don't have a job, this is what I will say: don't be selective. Apply for a job. Just apply to get something that will make you wake up in the morning.
I think you should emphasize that more, Dr. Rose, because you see, you're serving a generation that believes I should just be like, let me talk about media, what I've encountered. I should just be a celeb immediately. And I should get a job that pays me $1 million, like so and so, live in this place, drive this car. Able repeat that again. We should do what?
Life is a journey. If you don't have a job, look for something that will make you wake up in the morning. Even if you are being paid 5,000, at least you wake up with an expectation. I am going somewhere. And you know, Grace, at times it's not about the money. It's about feeling productive.
Yeah.
It's about feeling productive. And when you wake up with an expectation, that in itself keeps you going. There are people who wake up in the morning, Grace, they have nothing to do. No. Wake up, apply for a job, as long as you are not in the house. Wake up to something. Don't wake up to nothing.
Okay. Daktari, I have a neighbor who has, what are you saying, my dear listener? Daktari, I have a neighbor who always closed, let me see. I have a neighbor who is always closed indoors, doesn't socialize, always if it happens that you meet her outside, she pretends to be on the phone talking to someone so as not to talk to you. I'm disturbed. Can she be having a mental problem?
It could be yes or no. Number two, there's also the aspect of personality types. Our personality plays a key role on our social interactions, right? So there's a possibility either that's her personality. She's an introvert. Or it could be the person is having a mental disorder. So you cannot, because what I know with people who have anxiety disorders, especially generalized anxiety disorder or social anxiety, whichever the anxiety, because they are different, they will not like to be outside, right? So it's hard for me to tell. Could be if you have if you really want to reach out, could be if the person has a friend or a family member, that could be the right person who would help you. But I know there are people who are introverts. Yes.
And they love their space.
Yeah, they love their space.
Okay. This one is asking a quick one. Kindly ask Daktari whether inferiority complex is a mental disorder and what can be done about it.
Inferiority complex is not a mental disorder. It is how you perceive yourself. And one of the things that about inferiority complex, it makes one passive in life. They are not assertive. It's about how you perceive yourself. And that in itself can be a source of stress. Because people who have inferiority complex, they don't feel good enough. They will never be good enough. And they keep on comparing themselves with others. And that definitely can really affect their potential. They can even affect their confidence. So it's important for this person to seek help. Now, those are some of the issues that can take someone to see a counselor.
Yes.
Because inferiority, there's where it's coming from. There's a story behind it. So that now that story can be dealt with, and the person can start developing in a positive way.
Okay. We have a few minutes to wrap up, but let's tackle this one. You know, in one of the key things about self-care is spend time with you. Yes. I believe it was in the psychological one?
Yes, emotional. Yes.
And emotional. Spend time with you. Now, two people write. One says, kindly assist. I spend most of the time with constant regrets about my past. In my present, I've lost interest and passion in everything. Tired, fatigued, always concerned about my future. I feel anxious, overwhelmed, and helpless. I have no vision, no dream. Kindly help. And then the second person says, Daktari, now how do you enforce the me time, in quotes, in a family space where the man is somehow manipulative or insecure, basically clingy? Sasa hapo unasaidika aje?
Thank you. The first one was about... now I'm also forgetting.
Let's start with the clingy one.
The clinging one. Now, I may not understand what she means by clinging, but I know there are some person. I won't say the person has some personality disorder, but it's important for us to understand this person, the person we are living with. And creating me time does not even mean you go outside. Within your environment, what can you do? If the person is insecure, for sure there are people who are insecure. They want to know, where are you? What are you doing? Who are you with?
Yes.
Though to some point that can also be on the mental side. That is now more of the narcissistic personality, but I'm not saying that's the case. The question is now that you know this man, how can you still flourish in the same environment where I will not ask you, where are you? I want to believe you're not with this person 24/7. At least you go to work or something. So in that very environment, and not to create conflict, create that 1 minute, 2 minutes, or 10 minutes where you are just with yourself. That would be my recommendation. Now, there's a person who has talked about regret.
Yes, about their past. They've lost interest, passion in everything. They are tired, fatigued, always concerned about their future, feeling anxious, overwhelmed, and helpless. They have no vision, no dream.
That person, I will request the person to seek counseling, to see a psychologist, because there is an aspect of ruminating over the past. There is an issue of forgiveness, either forgiving yourself for having not done what you expected yourself to have done. And there could be so much that has not yet been said. So my advice to that person, because for sure I can tell, that person requires counseling. Let the person seek help from a counselor or a psychologist, so that they can unravel what is all this about. What is this regret? Because at times you only need to be in a counseling environment for you to understand yourself.
Yes.
And for you to move forward.
Okay.
Yes.
Thank you. Oh, we have a minute. Can you imagine? Let's tackle this one, the last one. My 22-year-old nephew sleeps a lot. He has no friends, has put his phone on flight mode and doesn't leave the house. He has started talking to himself and laughing alone. What is happening to him? He doesn't want to go to the hospital or even to church, but he says he wants shut down. How do I help him? This is a concerned auntie.
Now there's need for a psychiatric or a psychologist review. And 22-year-old young people, it's very hard for them even to seek help. This is what I will ask. Is there a friend? Now, this is where we use friends. Do you know one of his friends whom you can use to influence him to seek help? And this help the approach is very important. We are not taking you to the hospital because you are mad, because you have an issue, but because we want to see how best we can help you. So even as we are part of this therapy, you get the picture?
Yes.
So even as this person, because the concept of going to see a psychiatrist is you are mad, and yet that's not the case. So how you approach this 22-year-old is very, very important. If you approach him from a perspective of we need help, even us need help, and then use the closest friend.
Yes.
And even the day you are going to see the psychiatry, let the friend be there
Okay.
so that they don't feel alone. Yes.
Dr. Rose, I sense you need to come back and we just have a session where you'll answer questions. Nothing else. Answer
honored.
questions regarding mental health. For sure, my listener, I promise I'll talk to Dr. Rose and have that done. Quickly, it's one. Where can people get you?
Could I give my number? I work at Chiromo Hospital Group. Someone gets me, then gets the number, they will reach to me. 0723 37 6547.
Okay.
Yeah.
Thank you, Dr. Rose, and God bless you. Amen, my listeners. Sorry we couldn't get to all your questions, but you know what? For sure, I promise we'll have a session again where Dr. Rose that session pure will be focusing on your questions. It's 1:01. We have to catch up with the news at 1 with Kennedy Kimani on the other side of the studio. My name is Grace Mutiso. God willing, I'll see you again tomorrow right here, and keep it here. I think today you're having the cheerleader on Shangilia. I don't know, but you'll get to know. Have a beautiful one.
Hope FM.